Welcome to High Tea with Grace, where we spill the tea on HIT. I'm thrilled to be here at the HIMSS conference, interviewing the industry's greatest leaders about trends in the space. So tell us all, who are you and what do you do?
Oh, thank you, Grace. I'm Laura Kohlhagen. I'm the Chief Medical Officer for Sunrise at Altera Digital Health. And just give you a little background on Altera Digital Health. If you don't know, we're a global technology company providing solutions for healthcare organizations, things like EHRs, analytics platforms, revenue cycle, things like that. My role is over product strategy and clinical workflow design for Sunrise, which is one of our community-based EHRs.
Excellent. Now tell me, what trends are you hearing in the HIMSS hallways?
So a lot of things. Two main trends that I want to focus on that I think have been evolving over the past probably 4 years. Of course, AI. We're not surprised by that, but I think we're really seeing an evolution in AI. It's no longer pipe and pilots. It's real-world experience solving real-world problems. From my experience, I focus on clinician burnout. So the biggest solution there, of course, is ambient technology, and how that allows clinicians to place their focus back on the patient, and not on the documentation, which is a challenge. So that really has implications in terms of patient satisfaction, patients being heard, clinicians spending less time after hours doing documentation. You got more complete documentation. So, a lot of improvements in that area. And then on the other side, the other trend that we're really heavily focused on that I've seen evolving is interoperability. So another long-standing challenge, and really I think that's due to the evolution of TEFCA. The increased adoption of TEFCA, the expansion of qualified health information networks, QHINs. And it's not just the expansion of the program, it's how those documents are being utilized by clinicians. So historically, it's been CCDs, right? So if you think about, if you ask me for a telephone number, that's like me giving you a phone book, right? And you having to weed through it. And now we're looking to advance the technology, taking advantage of FHIR APIs so that clinicians can have the data that they need. So it's discrete targeted searches versus throwing the entire phone book at the clinician.
Oh,
So, I think both of those areas, it's so exciting that we're seeing advancements.
so interesting. Now I'm asking everyone here at HIMSS
Mhm.
what they feel to be the most underrated or under talked about health equity challenge right now. So tell me,
Sure.
what are you thinking or seeing in your area of
I think
influence?
the first challenge is identifying that there is a health equity. Um, in the EHR space, we don't have standardized ways to document social determinants of health. So I think that's another way that AI can assist us. And then when it comes to, after we identify the challenge, and we need to give the patients the tools, kind of meet them where they are. Similar to clinicians with ambient AI, right? Develop tools that support the natural clinical workflow for patients. We need to give them tools that they use in their everyday lives, right? Things like mobile first platforms that allow them to self-schedule, allow them to book telehealth appointments, remote patient monitoring, that kind of thing. So just to give you an example, my husband is a type 1 diabetic, and he hardly ever has to go in to see his endocrinologist because he's got a continuous glucose monitor that feeds him information every 5 minutes. He's got an insulin pump that reacts to the levels that he's getting from his glucose monitor, and his endocrinologist has all of that information. So it just makes management of that chronic condition so much easier for both him and the clinician that he's working with.
So cool. So cool to hear about that.
Yeah.
Now, we have a lot of young people here at HIMSS.
Mm-hmm.
If you could give your younger self a piece of advice about getting into health IT, what would you
Yeah.
tell yourself?
Yeah.
Yeah.
Well, I think I'm going to give you an answer from a physician, a female physician perspective. And I know you interview a lot of female physicians, so I'm sure what I'm going to tell you is not a surprise. But it's really, don't confuse exhaustion with dedication, right? So in medicine, we're taught that, put yourself last, put everyone else first. And I think that's challenging, particularly for female physicians. If you look at the data, you see that patients tend to share more with their female physician. We spend more time doing psychosocial analysis conversations, preventative health care, and a lot more time messaging in the portal. So we spend more time in the EHR, which contributes to that burnout that all clinicians feel that, I think is particularly tough on female physicians. So I would give myself that advice that, you need to find that balance. It's important. Because if you don't have the energy, you're not going to be able to take care of your patients. So,
It really feels like you're giving these young women and men permission
yes,
to really think that way.
right.
Yeah,
And I think that's
amazing.
changing. Historically, it wasn't like that, but I think people are much more open to talking about burnout these days and sharing that experience. So that can only lead to positive changes.
Such an inspiring perspective. Thanks for joining me today.
Thank you so much, Grace.